Located in Thunder Bay, Ontario, Hogarth Riverview Manor is a not-for-profit long-term care home operated by St. Joseph's Care Group. In January 2016, it became Ontario's largest long-term care home when it expanded from 96 beds to 544 beds.
Opening a home this large was unprecedented in Northwestern Ontario, and it was an adjustment for both our residents and our staff. Hogarth Riverview Manor struggled to maintain compliance with resident care requirements, protect residents from abuse, follow care plans, and meet reporting obligations. As a result, in 2017, the Ministry of Long-Term Care put Hogarth Riverview Manor under a mandatory management order and brought in a third party to co-manage its operations. This is our story of transformation and restoring confidence and trust in residents, family, staff, the public, and the ministry in our ability to deliver safe, resident-centered care. And it's a change I'm proud to say we've sustained even after the mandatory management order was lifted in September 2021.
We knew we needed to change. We were constantly dousing operational fires. Our critical incidents were rising. Communication was poor within and between teams. And our staff morale was low. We embarked on our operational excellence journey, iCare, in October 2020. The name iCare was chosen by staff and signified that quality and safety every day is everyone's responsibility. The iCare framework identified 4 areas of focus: organizational alignment, visual management, structured problem solving, and sustainability. To create organizational alignment, performance measures were developed, benchmarked against provincial averages, and cascaded to all 15 resident home areas.
To support visual management, a visual strategy room was developed to communicate the health of the organization in one room. Performance measures for the balanced scorecard and the 5 programs mandated by the Ministry of Long-Term Care are all displayed across the 4 walls in this room. The senior leaders and teams from the clinical and the non-clinical areas gather regularly to strategize and reflect on the organizational performance, identify opportunities, develop actions, celebrate experiments, recognize staff for their contributions, and deploy resources based on current priorities.
To build a culture of continuous improvement, Hogarth strategically focused on making improvement part of our daily work for all staff. Bringing quality to resident home areas, huddle boards were installed and became the pulse, where staff members gather daily to collaboratively address operational challenges, generate ideas to improve unit performance, celebrate experiments, and engage residents and families in their care.
Daily huddles and recognizing staff has created a culture of recognition and engaged continuous quality improvement across Hogarth. Spread common language, aligned strategic priorities with frontline work, improved communication by breaking down departmental silos, and has resulted in the delivery of improved resident-centered care.
On March 24, 2023, Hogarth celebrated the implementation of 2,000 quality improvements. The staff were recognized with a certificate of appreciation at the event. The key enablers of sustained transformation include education and training. In addition to the recurrent training, the frontline staff also attend quality awareness sessions. Everyone with direct reports attends either Leads Light 1-day training or Leads the Way 5-day training. Leader walkabouts at all levels. All managers have adopted leader walkabouts, dedicating time to hear from staff, residents, and their families for continuous improvement. No Meeting Zone. The No Meeting Zone creates a dedicated 2-hour block daily, supporting the managers to conduct quality huddles with their staff and focus on making and sustaining change. Technology. Targeted investments were made in technologies, including a new health information system to enable staff to spend more time on direct resident care. Governance framework. Our governance framework ensures accountability at all levels. The balanced scorecard is reviewed quarterly. The program steering and the Quality Safety Risk Committee meets monthly. The program working group meets weekly. And the unit huddles are conducted daily.
As the administrator of Hogarth Riverview Manor, I can confirm that the implementation of iCare has created an organizational focus for our home, established robust processes for our care delivery, and has improved the overall staff morale and trust between our multidisciplinary teams. We are hearing good things from our residents and our families and seeing the improvements reflected in our annual experience surveys. In my past experience working within other long-term care sites, what I see different with iCare is that we review our mandatory programs weekly instead of monthly. We analyze our data at a resident level to develop resident-specific strategies. And then our clinical managers involve the frontline staff to implement the identified improvements daily. This daily level of frontline involvement through iCare has played an integral part in building a culture of continuous improvements within our home.
So I've noticed so much change in the last 2 years. Of course, having COVID restrictions lifted has helped, but a new drive and morale in the home has been palpable with the implementation of the iCare system. Seeing and working with the team to develop goals that are attainable has been uplifting and really team building. I noticed that our physician complement has been exceptional, part of the team coming into morning huddles and really focused on resident care.
The staff is so good to us. I just love all our nurses. If I have a problem, if I have trouble sleeping, they sit down and listen. That's really good. That's important. It's been great.
Recognizing the sustained benefits realized from iCare, St. Joseph's Care Group is expanding the program to its other long-term care home and beyond. The practices implemented at Hogarth Riverview Manor have been recognized with several awards, including the 2023 3M National Team Award for Healthcare Quality.
Look for ways to create a culture of joy at the workplace and celebrate and recognize staff for the work that they do, and the results will follow.